Okay, Jovita, is your audio working?
I believe so.
It is. We can hear you. Wonderful.
My name is Jovita Dominguez. I'm the Chair of Education Licensing Committee, and I'd like to call to order and roll call. Jovita Dominguez present, and Dr. Fagan
Mary Fagan present.
and Trisha Wynn
Trisha Wynn present.
and Susan Naranjo.
Susan present.
Great. I believe we need to go to public comment for any other items that are not on the agenda for 8.1.
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. So it takes us to 8.2.1 and reviewing and voting whether to approve the previous minutes. Any board members have any comments on the or changes for the minutes?
No.
Then I'd like to motion to accept the ELC meeting minutes from June 23rd, 2022, and allow the BRN staff to make non-substantial changes to correct names, misspellings, and/or typos that may be discovered in the document.
I'll second.
Was that, Trisha Wynn
yeah.
will second. Thank you. May we take this to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in the request for comment. I have activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. I'd like to take the vote. I, Jovita Dominguez, votes yes. Committee member Trisha Wynn,
Yes.
Dr. Mary Fagan,
Mary Fagan, yes.
and Susan Naranjo.
I abstain. I wasn't here for the June 23rd.
Oh, say we will abstain for Susan Naranjo, committee member. Thank you. So this brings us to 8.3, and Dr. Marianne, Marianne McCarthy will help us leading this.
Thank you. Thank you very much. Good afternoon, Mary Ann McCarthy, Education and Licensing Liaison. Presenting, we're going to start with agenda item 8.3, discussion and possible action regarding whether to recommend ratification of minor curriculum revisions, acknowledge receipt of program progress reports, and whether to recommend ratification of clinical facility approval or other action. So according to board policy, nursing education consultants may approve minor curriculum changes that do not significantly alter philosophy, objectives, or content. Approvals must be reported to the Education Licensing Committee and to the board. Minor curriculum revisions include the following categories: curriculum changes, work study programs, preceptor programs, and public health nurse certificate programs. A list of schools who have submitted minor curriculum revisions, who have submitted clinical agency and facility approvals, and a third list of programs that have submitted progress reports that have been approved by nursing education consultants are in your materials packet in tables named the same. This is a consent agenda item. Thank you.
I motion to recommend ratification of minor curriculum revisions, clinical agency or facility approvals, and acknowledge receipt of program progress reports. Do I have a second?
Wynn seconds.
Committee member Tricia Wynn seconds. Thank you. May we take it to public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I would like to give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. I'd like to take it to a vote. I, Jovita Dominguez, votes yes. Committee member Tricia Wynn,
Yes.
Dr. Mary Fagan,
Fagan, yes.
and Susan Naranjo.
Susan, yes.
Thank you. Motion carries.
Thank you very much. Agenda item 8.4, discussion and possible action regarding whether to recommend approval, acceptance, or other action for approved nursing programs. These are consent agenda items, and there are 2 sections. The first section is continuing approval of a pre-licensure nursing program, and you will see those schools listed 8.4.1 through 8.4.5. And there's a second list of pre-licensure nursing programs making unit adjustments or other changes. They are substantive changes, but there's no enrollment increase. So the BRN staff have received and reviewed all documentation from these programs listed in agenda item 8.4. Information on these requests is on the list provided to you in your materials packet. These programs have met all board rules and regulations related to their requests and are consent agenda items. Thank you.
Any comments from the committee members? Okay, I believe we can take I motion to recommend continuing approval of pre-licensure nursing programs and approval of pre-licensure nursing programs unit adjustments, or the, other substantive, changes with no enrollment increase. Do I have a second?
Win seconds.
Committee member Tricia Wynn, seconds. Thank you. May we take it to public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box. I would like to make a comment. Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, I would like to make a comment. Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. So I will take it to a vote. I hope Jovita Dominguez votes yes. Committee members, Susan Naranjo. Susan,
Sorry, disconnected.
um, would you, like to vote, Susan, Mr. Susan Naranjo?
Sorry, yes.
Committee member Tricia Wynn
Yes.
and Dr. Mary Fagan.
Mary, yes.
Thank you. Motion carries.
Thank you very much. Agenda item 8.5, discussion and possible action regarding whether to recommend approval of clinical practice experience required for nurse practitioner students enrolled in non-California-based nurse practitioner education programs. The BRN staff have received and reviewed all documents for George Mason University in Fairfax, Virginia, for their request of clinical practice experience required for nurse practitioner students enrolled in non-California-based programs. Information on this program is on the list provided in your packet. This program has met all board rules and regulations related to the request and is considered a consent agenda item. Thank you.
Do any of the committee members have any questions or comments?
No.
Thank you. So I'd like to motion to approve of clinical practice experience required for nurse practitioner students enrolled in non-California-based nurse practitioner education programs. Do I have a second?
I'll second. This is Susan.
Committee member Susan Naranjo seconds. Thank you. May we take it to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box. I would like to make a comment. Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, I would like to make a comment. Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. I'd like to take a vote. I, Jovita Dominguez, votes yes. Committee members, Dr. Mary Fagan,
Mary Fagan, yes.
Susan Naranjo,
Susan Naranjo, yes.
and Tricia Nguyen.
Tricia Wynn, yes.
Thank you. Motion carries.
Thank you very much. Agenda item 8.6, discussion and possible action regarding acceptance of program progress report with discussion and possible action to address any performance gaps, including actions described in CCR Title 16, Section 1423.2, Subdivision A, for East Los Angeles College Associate Degree Nursing Program. Information regarding this program can be found on page 45 of your packet. And Board Moderator, would you please elevate the presenters on the list for East Los Angeles College? I am happy to report today that East Los Angeles College is in full compliance with all BRN rules and regulations at this time. Their NCLEX pass rates have risen, and the whole list is in your packet, but as of 2021-22, they're at 76.6. And the first quarter of 22-23, they're at 77.78. The program is requesting acceptance of their progress report, as well as full approval recommendation to the board in November, and possibly an adjustment in their progress reports, and whether or not they need to continue to come to every meeting and every board meeting. I'm their NEC, as you know, and the program representatives are here and available for your questions. Thank you.
Before we open it up to questions, Jovita, I want to take this moment to really commend the hard work of Dr. Marianne McCarthy, the consultants, as well as ELAC for working diligently to get the program back in full compliance. I know that it was quite the undertaking, and we are excited to see the progress that was made. And I can't wait till November 14th and 15th board meeting when the board can vote and put you guys back in continuing approval status and remove the warning with intent to remove program approval. Good job. Thank you guys very much.
I definitely was ecstatic to read, this is Jovita, ecstatic to read the big change, of improvement, and I commend them definitely, because we need nurses in that area, especially the ones that grow up there, that do go there. They do a better job. Maybe that's not the right word, but I definitely feel like they know the weaknesses of the community and how they can help them because they live there. Definitely, I applaud you. Thank you so much. I'd like to take a motion to recommend the acceptance of the program progress report and full approval of the board in November for East Los Angeles College Associate Degree Nursing Program. Do I have a second?
Mary Fagan, I'll second that.
Thank you, Committee Member Dr. Fagan. May we take?
Jovita,
Yes.
could I just ask for maybe a consideration on the progress reports and the attending meetings, if you have any recommendation to that? I have spoken with the program about sustainability. We're not done yet. And it is going to, take time and effort to continue to sustain this. But I do want to know if you have any recommendation to the board as far as their progress reports to me and to you, and also to attendance in meetings.
I believe that we can definitely, they still would give you progress reports, right, Marianne?
Whatever you ask them to do, they will do, yes.
Yes.
So how often would you like progress reports? I'm sorry, Lori.
Yeah, sorry. Jovita, I'll give some explanation for the committee members on this. Typically, when a program is in continued approval status, there is no recommendation from the board that says we need progress reports, we need check-ins. That is done as part of the normal workload and relationship between the nursing education consultant and the program. However, this is a school that has struggled for 10 years with pass rates that go up and then pass rates that drop down. And so there is a consideration that is being asked right now that says, even though they will be in complete compliance, this is the first time in many years, again, complete compliance with everything, they're doing an amazing job. It may be a benefit that the board continue to request some progress reports outside of the normal process to ensure that this continues. Right now, the ask when they were in the status, or currently in the status because we haven't went to the board meeting to change it yet, was in warning with intent to remove program approval. With that warning with intent to remove program approval, the ask was that the board, that the school attend every committee meeting and every board meeting and provide progress updates on each one of those. That consisted of 8 reports to the NEC annually. And that is 8 reports that came to cumulatively 4 to the committees and 4 to the board. It would be a consideration that the board could do an annual report. They can do a biannual report. You could also ask them to be present at each one of the regularly scheduled board meetings, and that would be a quarterly report. Those scheduled board meetings happen every 3 months per the statutory requirement. So the reason, again, I'll reiterate that this is being asked is not because they're doing anything negative. They have, in fact, successfully came into compliance with all board's rules and regulations. And they do have an established relationship with their assigned nursing education consultant, which is our supervising nursing education consultant, Dr. Marianne McCarthy. What is of concern is that they may dip down again in the future, and we want to make sure that we are on top of that and that we provide the assistance needed, any direction, any consultative services that we can provide so that they don't dip down and go back into a non-compliance. So there are options. The committee can make a recommendation to the board. If you do not feel comfortable as a committee making that recommendation to the board, this spiel will be shared at the board, and the board can vote and make a recommendation there as well. But it is up to you guys to manage this program or request these kind of progress reports if that is something you desire. Thank you.
Thank you very much for the explanation because that really helps me. I'd like to motion to have quarterly reports with every board meeting for a year and see how they do for the next, do we need to do this at the board meeting or could I motion to do it now, Marianne?
I know you said Marianne, but I'll jump in. You could amend your motion right now and add it to this motion as a recommendation to the board.
Okay, I would like to motion to recommend the acceptance of the program progress report and full approval by the board in November 2022 for the East Los Angeles College Associate Degree Nursing Program with a quarterly report for and with every quarterly reports with every board meeting for a year. Do I have a second?
I'll second that. It's Mary Fagan.
Committee member Dr. Mary Fagan, thank you. May we take it to public comment?
And while we're bringing up public comment, Jovita and Lori, I'm just curious, does that mean they can provide a progress report to me to put on the consent agenda item should anything, if everything's going smoothly, or do they have to come to the quarterly board meetings?
The request was to provide a report so that can handle through the progress reports unless you see something that would bring them forward.
Thank you very much.
Thank you, Lori.
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Kathy Hughes would like to make a comment. 1 second, please.
Hi, this is Kathy Hughes, registered nurse with the Nurse Alliance of SEIU California, and would just really like to take a moment to applaud both the work of the BRN and the ELAC administration. We're really excited to hear about these new NCLEX scores. Many of our members are graduates of ELAC and work in the hospitals in the area where ELAC grads either do their clinicals or practice after they graduate and get their licensure. So we're really excited to see this progress, and we look forward to hearing the continued good news in the future. Thanks.
Thank you for your comment. Committee Chair Dominguez, there are no other public requests for comment. Would you like me to close this window?
Yes, please. I'd like to take it for a vote. I, Jovita Dominguez, votes yes. Committee members, Dr. Mary Fagan,
Mary Fagan, yes.
Trisha Nguyen,
Trisha Nguyen, yes.
Susan Naranjo.
Susan Naranjo, yes.
Okay, motion carries. Thank you.
Thank you very much. Moving on to 8.7, discussion and possible action regarding whether to recommend continuing approval or other action for an approved pre-licensure nursing program. 8.7.1 is Golden West College Associate Degree Nursing Program. Information regarding Golden West starts on page 52 of your packet. And board moderator, would you please elevate presenters on the list for Golden West? Golden West Associate Degree Nursing Program had a regular scheduled continuing approval visit and was found to be in noncompliance in 3 areas. The program has worked with their NEC to bring the program into full BRN compliance, and Golden West is requesting continuing approval at this time. The NEC and program representatives are available for questions. Thank you. Jovita, if you're talking, you're on mute.
I'm so sorry.
That's okay.
I would like to motion to continue approval of a pre-licensure nursing program for Golden West College Associate Degree Nursing Program. Do I have a second?
Trisha Nguyen seconds.
Thank you, Committee Member Trisha Nguyen. We have a second, so can we take it to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. I'd like to take it to a vote. I, Jovita Dominguez, votes yes. Committee members, Dr. Mary Fagan,
Mary Fagan, yes.
Trisha Wynn,
Trisha Wynn, yes.
Susan Naranjo,
Susan Naranjo, yes.
motion carries. Thank you.
Thank you very much. Moving on to 8.7.2, discussion and possible action regarding whether to recommend continuing approval or other action for an approved nursing program, pre-licensure nursing program. This is the University of Massachusetts Global Baccalaureate Degree Nursing Program. Information on this program can be found on page 64, starting on page 64. And board moderator, would you please elevate the presenters for UMass Global? The University of Massachusetts Global was initially approved as Brandman University on April 11th in 2019. The program's control and name change was approved by the BRN in May of 21. UMass Global is an independent, nonprofit, California-based institution located in San Diego. They have a 1 year, they have 2 non-compliances right now that they're working on. One is CCR 1424D, which is sufficient resources. And their difficulty at the moment is specifically focused in the areas of faculty and clinical sites. They're having a lot of problems in those areas. And also CCR 1431, which is NCLEX pass rates, and they are below 75 for 1 year. And as always, we don't want to wait to see what happens. The second year is clearly a sign, but we'd like to get in there and work with them. And so our NEC has jumped in, done a visit, took a look at what's happening at UMass Global, and the NEC and the program representatives are available for questions. Thank you.
And then Jovita, just to jump in and provide some additional clarification on that. Typically, board policy is that first year dropping below 75%, they don't come to the board at that point. That is handled through the NECs. Excuse me. They work with the school and they get an action plan. And based on the action plan, it is monitored over the next year. And the hope is that action plan will help to raise the NCLEX pass rates back up above 75 for the first time test taker. If after the second year, the school remains with a low pass rate of less than 75%, that second year warrants a continuing approval visit with a full self-study, and the NEC does a full evaluation of that program because now it is 2 solid years that the outcomes that affect the graduate are negative, and that's where the public protection comes in. One of the many, so not just the only, but one of the many. What is important to kind of take into consideration with this report out is while that was being looked at, the initial action plan and looking at all this, there were other areas of non-compliance that warranted bringing it to the board. So it wasn't just for the low pass rate. The one thing that I would love to start a conversation or have kind of a seed planted for our committee members to keep in the back of their head when all of this is stuff is going on, and then we'll probably continue to have this discussion at the board meeting, is within our sunset bill, there was language that was put in that talked about enrollment increases. And talking about those enrollment increases, they limited the board to what they can look at, and that was based on resources only, and nothing beyond that we have currently in regulation. They did give the provision within the sunset bill to allow for the board to add additional items into regulation that would help the board to evaluate this process more effectively. When looking at NCSBN, the National Council of State Boards of Nursing, they have done several studies, and one of the Delphi studies that they did ID'd several factors that would identify a program to be at risk. And those are information that is really imperative when we look at addressing the Sunset Bill and we look at addressing these at-risk areas for schools that we would then add to regulation. One of those at-risk areas is not that they don't have clinical placements, but that the clinical placements are not robust. And I think that's one of the issues that's coming up with this school as well, is that they are having a very difficult time finding clinical placements, and that the clinical placements that are being used may not be as robust as they need to be able to answer or meet the objectives of the nursing program. One other thing to kind of take into consideration is our California Code of Regulation, which is 1427, which is the approval of clinical facilities. And that approval of clinical facilities specifically outlines that a program that utilizes an agency or facility for clinical experience shall maintain written objectives for student learning in such facilities and shall assign students only to facilities that can provide the experiences necessary to meet those objectives. And that becomes problematic with clinical impaction. That becomes problematic when the clinical sites that are being sought, because there is an impaction, they're going to outside areas, they're going to community-based, they're going to outpatient settings, they're even looking at acute care settings and kind of where can we put them, is that maybe those experiences are not meeting those objectives, even though those facilities are intending to meet them. When you look at acuity, when you look at patient census, et cetera. The one big thing that I want to point out, because, this is almost happenstance that this is happening at this board meeting, when we have, I believe, 6 enrollment increases to consider in the next agenda items, as well as a new program getting approved in the final agenda item for ELC, is how this kind of happened to this school. University of Massachusetts Global used to be Brandman University. Brandman University was approved in San Diego. They were put off a few years because of the lack of pediatric clinical sites and their ability to prove resources for that. So they were in their feasibility and acceptance of self-study phase for quite a long time. When Brightwood University abruptly closed, there was a vacancy of 150 clinical spots in that area because the projection was that school was going to be taught out and those students would no longer be in attendance at that school, which would then open up clinical placements for Brandman University to start up. Brandman University was then granted approval to start their program, and their enrollments were started at 75, annually. Brandman's enrollments, I believe, have they increased? Do we know what the current enrollments are for them right now? Is it above 75 annually?
Well, actually, I believe they had to take a pause.
They did.
And they did extend out over. They gave a longer period of time for students to finish during COVID. I do think they're trying to get back to their approved amount. I'm not sure if they're able to right now because of their because of the situation that they're in.
The resources.
I'm happy to ask the program if you'd like.
Yeah, we will actually touch on that if that was not in the actual written up.
Oh, it's in there. It's in there.
It is.
I just don't have it on top of my head. Yeah.
No problem. And so the other conflicting issue is that Brightwood, that closed, was absorbed by GCC. GCC as a service to that nursing group was amazing. They jumped in, they grabbed all but 2 of the students, and it wasn't that GCC didn't want them, but 2 of the students chose not to continue their nursing path. And they taught out that group, and they had great NCLEX pass rates, and they did a very good job. They came back in front of the board, and the board granted GCC to continue in San Diego. So now you're able to see that conflict. The board had approved Brandman, based on the fact that the Brightwood had closed, and now there was going to be an availability of clinical placements. However, Brightwood closing continued with the addition of a new nursing program, Glendale Career College. Glendale Career College has then come back in front of the board several times to ask for enrollment increases, and those have been granted in San Diego, in a very clinically impacted area. So these are the reasons why, as the committee members and as the board, to take into consideration of clinical impaction, resources, the status of the school, proven track records, et cetera, when looking at enrollment increases and looking at that community. We do know that there are workforce shortages. We on our website, there is a report that was recently published through UCSF, board contracts with them. And on that survey, they talk about a nursing shortage, and that California should meet and be equal by 2029 based on the current growth that is happening within our nursing programs. And that's great. Additionally, by 2037, that report shows that we'll have an excess of RNs as we continue to work through that process. One other thing that we have recently started tracking as a board, when some of these issues started to come out and were discussed in Sunset and such, is there is a document that's been added to the ELC agenda and materials that says board approved enrollment increases from 2019 to 2020. And that is carried over for ELC, and it's carried over to board when you guys make decisions. And I wanted to refer the board to that document on our website, excuse me, in the ELC materials, that shows the growth of new programs, the growth of new campuses, and the growth of enrollments over the last few years. Because that is really something that, as a board, this needs to be taken into consideration when making these decisions, so that we don't end up with a program in this exact situation going forward. And so it is unfortunate that UMass is now in this situation. They are located in San Diego County. There is a clinical impaction. They do have a San Diego Nursing Education Consortium. It is robust. It is very well ran. All of the clinical placements go through those that are within acute care settings and some outpatient settings as well. And but just kind of goes to kind of show that if we're not careful and we're not tracking the data, and that as we make these decisions, that it can affect the students that are enrolling into these programs that want to complete, and the faculty and admin at that academic institution really want to be successful, but they're limited in resources, and not necessarily to their own accord, but limited in resources in that area because San Diego is impacted. So just to give you guys that background, to give you guys the understanding of what happened to this school and why they're in this situation. And I do open it up now to board questions or comments and feedback from the presenters that are representing their school here today.
I just want to add, if I can, that their enrollment pattern is 24 students 3 times a year, and they currently have 149 students in their program.
So it looks like that's the same enrollment pattern that they were approved with at the beginning, with the plan that Brightwood, that had suddenly closed, would open up vacancies. But as we are aware, GCC took over that, and their enrollment has grown in the San Diego area. And now they're kind of faced with this issue that we should probably keep into consideration as we make some decisions here today. Thank you.
I just want to clarify too that GCC is now the Martha First School of Nursing. It used to be called GCC, but it's the Martha First because there are two GCCs.
Thank you for that.
Thank you, Mary.
You're welcome.
So, thank you, Lori. That was some really good information, because I have read this article and I find it very interesting. From UCSF, it's forecasts of the registered nurse workforce in California. Specifically on page 11, it states a shortage of RN is projected to persist until 2029, which is what Lori had stated, when supply and demand become balanced. But it also says by 2037, there is a projected to be greater supply of RNs than demand, with an 8.1% surplus. You know, I think we need to keep in mind as we do these enrollment increases that we look to the future of these students that are coming out of school, wishing to find a job to pay their student loans, to support their families within California. We have students now that are going out of state to get that experience. And this is an interesting article. To my knowledge, was there one or two schools in the past year and a half that had teach out plans because of clinical impact?
I think actually what's more of note in that report, and I'll try to pull it up really quick to see, is where they talk about growth. And they did show that when you look at our data, which is this document that we pulled up, we increased 1,457 students last year, and we're over 800 this year. And obviously there will be some enrollment increases that happen through recommendation today that will be counted on end of year numbers after their November board meeting if those enrollment increases are accepted. And so even though we're showing growth, what that report takes into consideration, which is what we did not consider in this report, is the pausing of pausing of admissions, and which is what was discussed, that UMass here paused admissions, and they instead of teaching them over a semester, they lengthened semesters, or they would skip one semester and then offer the next semester so that they can accommodate them in clinicals. But yes, there were also teach outs that occurred. We just had Holy Names that was not able to continue right now, that we have a teach out plan and their enrollments were absorbed by another school. We had Western Governors University that closed completely out of California. They still are up and going, but they're not in California because they had some clinical issues as well. But on the forecast of the registered nursing workforce in California, we do this through UCSF as a contract that shows that is done on every 2 years. And she used ample data. The first 13 pages, which is really great, is just kind of like the summary of everything happened in the last 13 pages of kind of how it happened. But the percent of change is really the big issue here. And it shows on page 10 that on registered nursing education, I'll read this here for the committee members as well as the public if they're not in front of a computer. It says, California nursing schools provided information about their enrollments and graduates for the 2020-2021 academic year in a survey that was fielded in the fall of 2021. Note that one private bachelor's degree program did not report data. The prior year's enrollments were used as an estimate for 2021 year. During the pandemic, many schools have been impacted by the loss of access to clinical sites and shifted instructed to online modalities to reduce virus transmission. 6 education programs indicated that they skipped an admission cohort in 2019 and 2020 academic year due to the pandemic. As seen in Table 1, there was a decrease in enrollment spaces available between 2018, 2019, and 2020, 2021, with a loss of 529 spaces. That's a decrease of 3.6%. That's not the board saying decrease. Those were schools that took that voluntary decrease because they could not support their students based on the available clinical spaces. There was even a larger decrease in total new enrollments with the decline of 1,146 students. That's down 7.6%. The 2019, 2020, and 2020, 2021 academic years were the first in more than a decade in which there were fewer new enrollments than spaces available. The decreases in enrollments were almost entirely in associate degree programs and public college and universities. So that's kind of the trend that we've been identifying, where we show that last year 1,401 enrollment increases went to private universities and colleges, and only 56 went to community colleges or public institutions. And again, that's better this year, much better this year. We have over 100 enrollment increases for the public institutions, but that really called out a glaring spotlight here where it shows private colleges and university enrollments increased 1.3% in this last term, where public colleges and university enrollments decreased 15.3%. And so those are, I think, what you were kind of getting at, Dolores, kind of showing that.
Yeah.
And so I wanted to refer them directly to that section on page 10. And then this was also kind of brought up by Jovita on the ELAC report out, where they're doing an amazing job, where she made mention that those students want to serve in the area that they went to school with. And so and that they know that area better than anybody else, and they know that community and can do an amazing job. And so those are the things that I think are really helpful in this information here. So thank you, Dolores.
Jovita, I have a comment also. Thank you, Dr. McCarthy and Lori, of course, for always setting context for us. And that report was very interesting on so many levels, but I was particularly taken by this discussion that Lori just entered into. We really have to watch, the decisions we make here are so complicated and so complex, but I am, kind of increasingly concerned at the costs associated with getting, a nursing degree, where we do seem to be accelerating approval of increases in private colleges, and maybe not, worrying enough about, the decreases at public, in public education, where kids can get, or young people can get their nursing degrees for very little money and emerge maybe without debt or very little debt. So anyway, it's just something that I've got on my, screen kind of going forward. And I really appreciate this conversation. The report was really useful.
Yeah, I second that, Trish. I second that.
Do we have members of the school that wish to make comment or provide any insight?
I have a comment too. I don't think that this report is available on the BRN website, or at least I can't find it searching for it. So we want to make sure that it does get published. The most recent one that I found on the website was from 2019.
It is on the
It's
website.
there.
I will share my screen really quick, and I will walk you guys through that so you can find that. Give me 1 second here. Pull that up. Make sure that is.
And while she's pulling that up, Alice, if you want to speak after this, you will have the floor. Thanks.
Perfect. So when you are on our website here, I'm going to take you to the home screen. Are you guys all able to see that?
Can you make it a little bigger?
Don't know that I can make it bigger.
Okay.
This might be it. I'm sorry.
You can make it larger on the screen if you need to.
Does that work better?
This is David Lawler. What you can do on the top of your screen as you're looking at your own device, you see a plus sign and a minus sign.
Yep.
If you hit the plus sign, it will zoom in for you.
Perfect. So on our home page, you scroll down onto school reports, and you click on other surveys and reports. Once you click on other surveys or reports, you can scroll down to right here, biannual RN survey and forecasting reports. It is the very first one that says forecast of the registered nursing workforce in California 2022. You will click on that, and that'll take you to the report that we were talking about right now. Page 10 is what I was referencing right here, and the table as well. And this is available on our website. While we're here, this is actually where a lot of our reports are. So you'll find school reports. These are done on an annual basis. We have one out right now for our students, our schools to complete. We have the forecasting report that is biannual, so every 2 years. There are other workforce reports here. We have a Diversity of California Nursing Workforce Chart Book that is hugely informative. And then on the bottom, our favorite, our Sunset Review reports. And I said that being a little facetious with that. So I'm going to stop sharing and hopefully that helped.
Can we please put that on the what's new on the homepage? Because when people aren't going to remember how to dive into that, if you just go into the search page and put forecast, nursing forecast, the most recent one that comes up in the search function is the 2019.
Yep, I will request IT to add that as a link into what's new and then make sure that that's captured on a search.
Okay, thank you.
Mary.
UMass Global, did you want to make a statement?
This is Alice Nokes. I'm the program director for UMass Global's undergrad pre-licensure program. I want to thank Dr. McCarthy and Lori for contextualizing the challenges that we've had with clinical placements. And ultimately, I believe the impact upon our NCLEX pass rate and secondarily to the shortage of nursing faculty. We are in a highly financially impacted part of California as well. So we've worked very, very diligently to secure more rigorous clinical placements, and we believe that we have done so. We've had to go outside of the consortium to do that because we are the newest program to enter the consortium. And as such, the hierarchy is very rigorous and prevents us in many cases from finding placements because they are grandfathered by those schools that have already had those placements. So we're pleased that we have secured very good placements, we believe, with Hoag Hospital, who have invited us, as well as Specialty Hospital of San Diego, which is an acute care rehab hospital. And we have other affiliations that we're looking forward to. Most recently, we've been denied our pediatric rotations through the consortium, so we are right back to square one with trying to find suitable placements for our students going forward in pediatrics. It's been very challenging. We have a wonderfully diverse, dedicated group of staff and faculty and administrators who all have been working toward the same goal, which is quality of education, resulting in safe practice of every graduate that we would like to contribute to the discipline. Thank you.
Thanks, Alice. Jovita, if you're speaking, you're on mute.
Actually, I was thinking.
Oh, sorry. I can't see you on my screen. I'm so sorry.
I know it was a challenge today. Actually, I need some guidance because so since they that dip in their NCLEX, can you guide me on how to use this motion to maybe it's a little difficult for me to come up by myself. I need like a motion, like, basically to keep them, to keep like reports and see if I don't want them to decline less than they already are.
Right. So the motion on the screen for deferred action, Jovita, just means that they don't lose they don't lose anything. You're just not making a decision. You're giving them time to do whatever you guys decide. I mean, they're going to be working on it, but as far as progress reports or whatever you want, but the deferred action just means that you're not making a decision right now. You're recommending that the board give them some time to work through that. So that's what deferred means. And then the with or without other action, that just means if you want to add anything like progress reports or, and that's totally up to the committee.
And then real quick to add on to that, Jovita, it may not be absolutely necessary for you to do any additional progress reports or anything on this because this is only year one for this school. We typically do not make any additional kind of movement until year two, if they go 2 years less than 75. And the good thing is because of the policy, and this is in regulation, for the 1 year less than 75 is that action plan. And that action plan is monitored very closely between the school and the nursing education consultant assigned to it. So you may just be covered in this instance as just making the motion to recommend deferred action. And then moving forward with this year per our regulatory requirement that comes in 16 CCR, and that is on one of the last ones, which is the licensing examination pass rate standard, which is 1431. And that talks about a program exhibiting a pass rate below 75% for first-time candidates in an academic year shall conduct a comprehensive program assessment to identify variables contributing to the substandard pass rate and shall submit a written report to the board. This report shall include the findings of the assessment and a plan for increasing the pass rate, including specific corrective measures to be taken, resources, and timeframes. And so that is already our law, that is already in regulation, that's already happening right now because of their first year being less than 75%. And so there may not be more that needs to be done at this time. So I just wanted to put that out there, Jovita, as we may be covered with just that current regulatory authority.
Thank you. So I will take the motion to recommend deferred action for continuing approval for University of Massachusetts Global Baccalaureate Degree Nursing Program. Do I have a second?
Tricia Wynn seconds.
Thank you. May we take it to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Mitchell first would like to make a comment. 1 second, please. Mitchell, are you there? It's either #6 or *6. One second. It should be *6.
Are there any more requests for public comment, Mark, that we can move on to while we work out that technical difficulty?
No, he's on an iPad. Sorry, I have no other suggestions there. There are no others. I'm sorry.
Okay, thank you. We'll continue to try to work with him to be able to give him public comment. Is there a call-in number that he can call in and get public comment instead of coming in through his iPad?
Yeah, he's going to try another device.
Perfect, thank you.
Should we go back or?
Can he type out his request? I mean, he seems to be able to type,
Yes.
letting us know that he's unable to.
It is important to hear from him. He is the Marcia First School of Nursing, the other school that we mentioned on here, and I'm sure he would like to have some say in kind of the discussions that went around with this. He did just suggest in public comment on the screen here, perhaps you guys can move on. I'm trying to log in. If that's something acceptable, Reza, that we can do, and then have him provide his public comment when he's able to come in. What are your thoughts on that, Reza?
That would be totally fine. Yeah. Oh, sorry. Speaking to my mic. That would be fine if you want to move on and circle back to this, as long as you just announce that we're going back.
Jovita, we can close public comment and go for a vote.
Thank you. I'd like to take a vote, and this is Jovita Dominguez votes yes. Committee members, Dr. Mary Fagan.
Mary Fagan, yes.
Tricia Nguyen.
Tricia Nguyen, yes.
And Susan Naranjo.
Susan, yes.
Motion carries. Thank you.
Thank you all very much. We're going to move on to 8.8, discussion and possible action regarding the acceptance of substantive changes to approved nursing programs. As Lori said earlier, there are 6, and I also want to reiterate something else she said. Recently, probably for at least the past year, we've been giving you information about workforce and data on what we have and what the program has and whether that matches up. And with the sunset bill and those changes, we're not going to be able to do them. So we stopped. We did not put that on here at this time. So that will be a change that you're seeing, that there won't be any data regarding workforce on these. Okay, so 8.8.1 is Concordia University Irvine Baccalaureate Degree Nursing Program, an enrollment increase. So information regarding Concordia, they actually have 2 separate requests today. So this will be their first request for an enrollment increase, and it can be found starting on page 69 of your packet. And board moderator, if you could please elevate Concordia as needed, so they're available if needed. The Concordia Nursing Program is requesting a substantive change enrollment increase in their 3rd cohort of 64 students so that they could have 3 consistent cohorts of 64 enrolled annually. The program currently has 2 cohorts of 64, and then back in that started in January, and now they came back and asked in November of 21 to add a 3rd cohort of 64. They weren't approved for the full cohort of 64. They were approved for 24 and were asked to, come back if they wanted to increase. So that is what they're doing. They're coming back from their November 21, a year later, coming back wanting to request the transition from 24 students annually in their 3rd cohort to 64. So they'll have 3 cohorts of 64 annually at their main campus. On the NEC for Concordia, and the program representatives are here for questions. Thank you.
This is Jovita. If this, other than this meeting here today, regarding the increases that we have been doing or partial increases, I feel like 8.8.1 and 8.8.2, I'd like to see if we can move those for the November 14, 15 meeting, just because they are in the area of impaction. I don't feel comfortable giving a motion to recommend. And then also, when we're done with that, I'd also like to talk about 8.8.6 when it comes to that. Just a concern that I had. Any other comments from the committee members?
This is Lori, not a committee member, but just clarification here on 8.8.1. Are you saying that you're deferring any action to the board? Was that your motion, or I'm not sure that I was clear on the motion. You didn't feel like making a recommendation to accept or deny. You're asking to defer making any action to the board, and that way the full board can make a decision on the request for 8.8.1 Concordia enrollment increase for University of Irvine?
Yes.
Okay, thank you. I was just not clear on what the ask was. So your motion is to defer making any action on 8.81 until the board meeting. Is there a second?
May I ask a question first?
Absolutely.
So does this happen much where we would take, item out of this committee and send it to the board for, kind of the decision-making, the policy?
Yes,
decisions?
that has happened in the past. Typically, it occurs if there is more data that's needed, more information that's needed.
And is that what we're hoping? Is that what we're hoping we'll find out in this delay of a month?
I'm not sure, because I'm not sure that there's going to be more data that's going to come available. This is also done when there is a broader discussion that typically needs to happen between all of the board members versus just committee member interaction. And that happened, I believe, when ELAC was being considered for a pause in enrollment. It also happens when enrollment increases aren't absolutely clear that there is a need and an ability to support that need by that program. And just for clarification, it's only going to be about 3 weeks before the board meeting. And even if this committee were to say, yes, I recommend approval, or I recommend not approving, nothing can actually be done until the board meeting. So there's not going to be a delay. So just to clarify that, there will be no delay of outcome here at all, because a decision should be reached at the board meeting, which would happen routinely. So there's not a delay.
Thank you. That's helpful. Thank you.
Yeah, perfect. What the school likes to hear in the committee meetings is kind of what to expect at a board meeting. So if the committee says they recommend not approving, then the school typically knows kind of what to expect at the board meeting. They go out and seek recommendations of support. They contact their representatives. They reach out to the board. A lot of people will receive emails and mails and stuff that start to say, we support this increase. And if they are recommended to approve from a committee that goes to a board, then a lot of times we don't hear anything because they kind of know that it's going to have a favorable outcome for them at the next board meeting. So hopefully that helps.
Thank you, Lori.
Yes.
The way you put it is very intellectual, and I appreciate that. It's just that I personally don't feel comfortable, and then I wanted the input of the full board and a broader discussion, so that way we could get the input as a whole board members.
Perfect. So we have your motion, Jovita. We're still waiting on a second.
Yeah, I have a question though.
Mary has a question.
Yeah, I'd like to hear from the school if we could before considering a motion.
Of course.
Possible. Because there is a very extensive write-up from the program about their clinical placement opportunities and working with the consortium and ensuring us that there would not be displacement. So I'd really like to hear that how that could be assured in terms of what was written in the write-up.
Perfect. Cheryl, are you elevated and able to speak?
I am here. Can you hear me?
Hi.
Hi. Thank you very much for that question, Dr. Fagan. Yes, we have been able to secure and have really not had much of a hiccup of placing students. So with last year when we were approved for the 24 enrollment increase instead of our ask of the 64, it actually almost became a burden for us because we had 64 placed, and then the cohort of 24, we actually had to give away some of our placements because we only had 24 students. And so of course, we have very good relationships with our clinical partners. So we were able to say, okay, we're going to pass this time, but we're going to come back next time and hopefully have that placement back. So the concern for us as the university is that if we are giving away these placements, even if they're temporary, they can replace them with another school, and then that would displace our students. So that's been the challenge of having just the 24, where the other cohorts have been 64. And just to kind of comment on that too, in the last year, we've actually have approximately 10 more affiliation agreements in the last year. We've really been innovative in reaching out to the community. We have acute care as well as school districts and some other really innovative ideas to place the additional 40 students. So we don't see that there would be an issue.
I did just want to share from my perspective as a chief nursing officer, if you've got the students here for one semester or trimester, I guess, and then you already have those placements defined. So this to me doesn't feel as much of a displacement as if you were going to take all of your quarters or trimesters or whatever and increase all of them as opposed to just increasing one. Just my perspective.
Vita, this is David Lawler. May I ask a question?
Yes.
Are you recommending this to be discussed in closed session or agendized in the public board meeting?
Public board meeting.
Okay, thank you.
Yeah. Just to be clear, David, there's specific rules that could bring it into closed session, and that there's nothing that meets that ruling for this, and so it will have to be public.
That's
just
why I wasn't sure what she was talking about.
Yeah, no problem. I know this is a new motion that the new board members are coming up against. So all the questions and clarification that's needed, we're here for that. What Dr. Mary Fagan just mentioned, that's accurate. Clinical placements, and this was kind of discussed earlier today, where they talked about having to go through the consortium and their newest program being at UMass that was just kind of brought up. They're the newest program in that consortium. And so they're not able to get any clinical sites because of the, they call them squatters' rights. And that's exactly what Dr. Mary Fagan was alluding to, is when you're already established at that facility, those dates and those clinical placement times are set per school. And so when you have one semester doing 64 and the next semester doing 64, and then you do the next trimester and you're only at 24, they're used to, that clinical site is used to accommodating 64 on a routine, regular basis. And so it doesn't have an impact much to that healthcare facility. It's easy to kind of keep those on target, to keep those schedules going. But I offer up kind of a question and a concern just that is brought to me by other schools and stuff when they reach out to the BRN, is those breaks where a school may not be utilizing that facility could really be offered up to other schools in that area for makeup. And just to put out there again on our Sunset Bill, AB 2684 added a concurrency provision. There was a concurrency provision previously for theory and clinical practice to go hand in hand, and that's been our law indefinitely from 1426, 16 CCR 1426, a concurrency of theory and clinical. When the state of emergency broke out, AB 2288 was put into effect under an urgency clause that allowed for students that were scheduled for theory and clinically concurrently in the same semester, that any direct patient care that they couldn't meet in that semester, that they could then make that up in the very next semester. So if you have 100 clinical hours and you had 25% that you did in a simulation lab, you had 75 hours that you still had to do. And say that student was only able to complete 50 of them, they still had 25 more hours to complete of direct patient clinical care. That means that those students could complete those 25 hours in that very next semester. That was put in through AB 2288 per the state of emergency. And that was a needed provision during the pandemic. In Sunset, we were kind of asked about that. And I talked about it being a bad payday loan, where when you move those clinical hours that you can't get out of this semester into a next semester, you still have clinical hours you have to make up in that next semester as part of your normal schedule. You're already exhibiting signs that you're having problems meeting those requirements. And now you just added an additional time commitment for clinical hours into that following semester. And so we have schools now, because this has become a permanent provision. It is part of our sunset. It will no longer be part of a state of emergency, that schools have that flexibility to do that. That concurrency flexibility is now going to be longstanding, and schools, as long as they schedule their theory and clinical together, any direct patient clinical hours that they can't complete during that semester can be completed in the next semester. And so these are things that the board should take into consideration as well. We will be having schools that will need to have their students to be able to complete clinical hours that they don't normally do as part of that routine schedule. It's going to go off schedule going forward based on that provision that was put through for concurrency in this sunset bill that goes into effect January 1. And so our clinical facilities are going to have to schedule things differently to accommodate that, because there will be schools that will be looking for other sites to be able to make those hours up. And I just want to put that on the radar. That's brand spanking new, that just came out in our sunset bill, and that will go into effect January 1, furthering the complexity that our BRN, that our board has when making these decisions. Because yes, currently, if you have these placements set in your that's what it is. And hospitals and other healthcare agencies make plans based on that set schedule. And so this typically would not be impact much at all. They would just go 64 3 times a year and have a non-issue. But now that we have this concurrency provision that has been set in law that will go on indefinitely, and it is not tied to the state of emergencies, we will have to get creative within our healthcare facilities to allow for those scheduling, because we will have students seeking hours outside of their routine schedule because of this concurrency provision. Just wanted to put that out there. Thank you, guys.
Which makes my decision to defer even more reason. So, is there anybody that will second my motion?
This is Susan, a second.
Thank you. Can we go to public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I have activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Mitchell first would like to make a comment. Mitchell, what does your phone number start with? One second. Now it's *6.
Hi, can you guys hear me? It's Mitchell.
There you go. Thank you, sir.
All right, finally got connected. Maybe no Apple products for this meeting, you guess. I wanted to make a comment about that last agenda item. I'm just checking in to see if this is the most appropriate time to do that. I know there's like a motion on the floor. Do you want me to hold off until another time in the meeting?
Committee Chair Dominguez?
Loretta or
It's
Marissa?
completely appropriate. We made the provision to take you as soon as you were able to get on, and this is a perfect time, Mitch. Thank you.
Thank you so much. So, hello, members of the committee. I was listening to the dialogue, about the Marcia First School Nursing and GCC. I just wanted the committee to know that that campus in San Diego, we've only been before the board one time to ask for an increase in enrollment, which was only an additional 15 students 3 times a year. So I just wanted to clarify that, and thank you, Executive Officer Melby, for the compliments about how we were able to do that great work with the Brightwood students there in San Diego. I also just, while I have the time here with all of you, I just want to share that, we continue to talk about the surplus of RNs and what that looks like, you guys, but that's just not consistent with the CEOs and the CNOs that I continue to talk to in all different service delivery areas. They need more nurses, they want to hire more nurses, and they want us to enroll and graduate more nurses. And so I'm also on the board of governors for Adventist Health, which has, as you guys may know, have lots of hospitals and acute care clinics all over the state of California. And recently, the CEO of Adventist Health said it's the biggest existential threat to their entire health system is their need for RNs. So I just would like you to ponder that. And lastly, I know there's continuing discussion about the cost of our institutions in the private sector and that type of thing. But you guys, the students choose with their feet. They want to come to our schools because they know when they're going to be, when they're going to start, when they're going to end, and they're going to have a parking space. Their classes are going to be sequenced. They do pay more in tuition for our schools. Our institutions are not highly subsidized by taxpayer dollars. So this is why our tuitions are higher. But most importantly, the student chooses with their feet. They come to our schools because of our outcomes and our ability to do the things I just shared. Thank you so much for listening.
Thank you for your comment. Committee Chair Dominguez, there are no other public requests for comment. Would you like me to close this window?
Yes, please. I'd like to take it to a vote. I'm Jovita Dominguez votes yes. Committee members, Dr. Mary Fagan.
I'm going to vote no.
Susan Naranjo.
Susan, yes.
And Trisha Nguyen.
Trisha Nguyen, yes.
I believe motion carries. Is that true, Dr. Mary Ann McCarthy?
Yes, and the motion will be defer action. So no action. This is going to move forward to the board.
Thank you very much.
You're welcome. Next agenda item is agenda item 8.8.2, discussion and possible action regarding acceptance of a substantive change to an approved program. This is also Concordia University Irvine, their baccalaureate degree nursing program. However, this time they are looking at a secondary campus. Information about this program starts on page 76 of your packet. And board moderator, if you could keep Cheryl in the wings, that would be great. The Concordia Nursing Program is requesting a substantive change, addition of a new campus that is located in Ontario, California. The enrollment pattern request is 72 students 3 times a year, and they want to phase this in over 3 years. So 72 is like their final, and they're going to phase it in. So it's in your materials, but I'm also going to tell you how they're going to phase in. They want to start with 48 students in the fall of 23 and the spring of 24. Then they are going to follow with 64 students in the summer of 24, and then get to 72 students in the fall of 24. So then once we get to 2025, their spring, summer, and fall will all have a full-size cohort of 72 students. The additional site will be different only in the format for they will offer their courses, their didactic courses hybrid, which their current program in Irvine is on ground. And then all their objectives, their policies, their outcomes, everything is exactly the same. I did do a site visit in Ontario virtually and found them to be in compliance with resources available for students. I'm still their NEC, and they're still here to answer any questions about a secondary site in Ontario. Thank you.
Do any committee members have any questions?
This program is going to be in an area where there is a designated need and not an oversaturation or impaction, correct?
That is correct, Mary. Ontario is proven to have needed nurses and growth in nursing programs, and the board has answered that in the last couple years. And I think that by listening to public comment when both of those previous actions came in front of the board with a school, American Career College grew with a new campus in Ontario of 125 annually. And that was approved by the board. And then Arizona College, they had a feasibility study that was accepted for Ontario for 120 annually at the November 2020 board meeting as well. And so they were just accepted in a new program with that same enrollment rate in November of 2021. So we did see a 120 annually for Arizona College. We did see 125 annually for a new campus from American Career College. And those were 2 direct areas of growth in Ontario over the last 2 years. So there has been some approvals, and this is a 3rd approval coming for that area. I know that when Arizona and ACC were brought forth in the November meeting last year, there was discussion regarding the annual enrollment. I believe Arizona is over 3 years. And so it was 120 for 3 years with a total enrollment of 360 going into that area. And then American Career College was 125 annually. They're a 2-year program. And so that would be 250. So we have 360 and 250 kind of coming out from the colleges to manage enrollments on an annual basis when they're fully implemented.
Then I'd like to make a motion that we approve the changes for the new program.
I second Jovita Dominguez. So the motion would be to recommend acceptance of substantial change to an approved program enrollment increase, addition of a new campus or location for Concordia University Irvine degree nursing program. Is that what you would want, Mary?
This is a different motion. We're talking about the Irvine campus or the Ontario?
It's the Ontario campus.
Yes.
That's the name of the school. Their name is Concordia University Irvine, but they are having a secondary campus and that's a good question, in Ontario.
As part of the motion, Dr. Mary Ann McCarthy, can we add the campus location and the enrollment number can you repeat
Sure.
that after that so that could be added to the motion?
Sure, absolutely. Get my paper back here. So the location is going to, so a secondary, it's going to be recommend acceptance of a substantive change to an approved program, an enrollment increase, addition of a new campus or location in Ontario, California, with an enrollment pattern of 72 students 3 times a year, phasing in over 3 years. And Lori, do you want me to add the phasing in part?
Yes, that would be
48.
appropriate.
Okay.
Yeah, as the
And
board motion.
if any of the people taking notes need me to send this to them, I can. Starting with 48 students in the fall of 23 and the spring of 24, 64 students in the summer of 24, 72 students in the fall of 24, and then starting in 2025, 72 students 3 times a year.
That's my motion.
And I second Jovita Dominguez.
Perfect, thank you.
May we take it to public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give reminders as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Kristen Christopherson would like to make a comment. 1 second, please.
Good
Go ahead.
afternoon. Thank you. Good afternoon. My name is Dr. Kristen Christopherson, and I am the Regional Chief Nursing Officer for Prime Healthcare. My responsibilities are the California and Nevada hospitals for our health system. Just a little bit about our health system. We're the 5th largest for-profit healthcare system in the United States and operate 45 hospitals in 14 states with more than 300 outpatient locations. Just in Southern California, we operate 17 hospitals, 7 of which are within 50-mile radius of what Concordia University is asking for. In my previous role as a CNO for a large hospital in Orange County, I had an outstanding relationship with Concordia University and their organization. They have a very robust clinical partnership with their program in Irvine, and their students have been exceptional. And when I heard that Concordia was looking for a partner in the Inland Empire, I was glad to assist. Prime Healthcare supports the need for expansion, and I am glad that you all are making the same recommendation. The state of California does have a nursing shortage, and it's only been exacerbated. Just to speak specifically about our hospitals, we are struggling to fill positions. And while I know that the board is concerned about RNs finding work, we are currently closing units, we are diverting patients, we are stopping surgeries because we don't have enough staff. And we foresee this shortage happening over the next couple of years and into the future. And as registered nurses take positions outside of hospitals, I was shocked the other day when a nursing student told me that their goal was to work in aesthetics. Good for them, but that doesn't help us in the hospital setting where our patients need us the most. We currently are experiencing RN vacancy rates up to 30% in some of our hospitals, which is unsustainable as we bring in travelers, which are bankrupting the labor costs in our facilities. We're spending an average of $750,000 to $1 million a month just in RN replacement costs. And as of Monday, this past Monday, October 24th, in just the facilities that Concordia would serve, I have approximately 410 open RN positions for 9 hospitals. Expanding Concordia University's nursing program is critical in strengthening our pipeline, and I appreciate you making the recommendation. Thank you for your time.
Thank you for your comment. Committee Chair Dominguez, there are no other public requests for comment. Would you like me to close this window?
Yes, please. I'd like to take it to a vote. I hope Dominguez votes yes. Committee members, Tricia Nguyen.
Tricia Nguyen votes yes.
Mary Fagan, Dr. Mary Fagan.
Mary Fagan, yes.
And Susan Naranjo. Susan?
I believe we have a quorum without her, so
Yeah.
if she's not on, we could just, we'll just put absent for her.
Okay,
Yeah.
I don't see her.
One second here. Yeah, it looks like she's dropped off the panelist. Can I have board staff reach out and try to reconnect Susan if needed, please?
So our motion carries. I believe Susan Naranjo will be absent for this vote.
Thank you. Okay, we're moving on to 8.8.3, discussion and possible action regarding acceptance of substantive changes to an approved nursing program. This program is Unitech College Baccalaureate Degree Nursing Program. They're asking for an enrollment increase. Information on this program can be found starting on page 83 of your packet. And board moderator, if you could please elevate the presenters for Unitech. Unitech is requesting an enrollment increase at their Bakersfield campus. You will see in my agenda item summary, they currently have campuses in Fremont, Bakersfield, Concord, and Sacramento. So this is specifically for the Bakersfield campus. This proposed enrollment increase requests a total of 40 students that will start twice a year, which will have 80 new students annually in this Central Valley location. This will increase the total student enrollment for the Bakersfield campus to from 120 students per year to 200 students per year. This proposal comes as a result and in the support of two healthcare systems in the area. Kauai Health is requesting 25 students twice a year, and Sierra View Hospital is requesting 30 students annually, which is 15 students twice a year. Students will be recruited within the hospital facilities, and enrollment will also be open to local members of the community. Their proposed start date will be January of 23, with the first cohort graduating in November of 25. I am their NEC, and the program representatives are here should you have any questions. Thank you.
Thank you, Mary Ann. For the committee members, I just want to point out on our chart, this is a request for Bakersfield. In February of 2022, California State University BSN did an enrollment increase. They increased from 60 students to 76 annually in 2022. And then up to 92 students by 2024, an increase of 32. And that was approved by our board. And then the year prior, there was a request for Bakersfield as well. And that was with Glendale Career College Associate Degree Nursing Program. They created a new campus in that location, and they added 135 annually to that new campus location. And those are the—
And if I could clarify as well,
for
thank
Bakersfield.
you. I would also like to clarify that although the program, the actual physical building is in Bakersfield, their didactic part of their program will be online. And where these two hospitals are between Bakersfield and Fresno, in kind of the Visalia area. And so they are serving that community between the two, although it is a program, an enrollment increase to their current campus in Bakersfield. their students will be didactic online, and then doing all their clinicals, their skills, their simulation at the hospitals that will be in their community. They won't be quote unquote driving to Bakersfield.
Oh, perfect. That's great information. I'll add then 2 years ago in 2021, the board did one enrollment increase to College of Sequoias, an associate degree nursing program. They went from 100 students to 120 students in the Visalia area. So still a need for growth based on the numbers that we have in front of us.
Thank you.
So, Marianne, just looking at the, brief staff report, $138,000 for the program for 2 years.
It's a baccalaureate program, so.
So it's a 4-year.
Yes.
Thank you.
I mean, there's the possibility that they would take students that maybe are LVN or have done some of their prereqs and stuff. What the ask is that the hospitals are asking, they want to get their employees to get their BSN is what they want to do. So any of their employees who are interested will be encouraged, and their work schedules will, make it possible for them to go to school.
So if that happens, Marianne, do they get an assist on the tuition from work? And I'm gonna let Dr. Joseph speak to this, but yes, they're in an agreement between the school, Unitech, and the facilities. Dr. Joseph, do you want to explain that collaborative you have?
Yes, hello. Thank you, Dr. Marianne McCarthy, and hello, board committee members. So this is a unique request with a unique partnership. So we have 2 clinical facilities in Porterville and Tulare County that came to us, and we partnered together. And the goal of the partnership to really improve the healthcare access in that community and improve the quality of life of the people of Tulare County by bringing the program to that facility. The students will be basically employees of these 2 facilities within that community. And to answer your questions about the tuition actually, after we give our scholarship and the employer provide their contribution, it goes down to, for an advanced placement, which is 2 years, it will go down to $38,000. That's for the student to pay. And there will be financial aid available for that student to take the loan. So it's complete. It's basically a full partnership, academia, practice coming together to help the community by improving the seats. As you know, Tulare County is designated as an area of registered nursing shortage. And the whole area, the San Joaquin Valley region is considered as a medically underserved region altogether. And when we looked at the numbers, I know the board did a lot of work over the last 2 years adding seats. 15 seats that was added. There were 6% of those in Tulare County, only 6%. And this region, as everybody know, with the reports that publish, and I can go on like running the numbers and show you the numbers because there is a lot of support and research talked about Tulare County especially and the region of San Joaquin Valley, that we will be facing shortage until 2035 for nurses because of some of the nurses migrate out of the area and they go to LA and San Jose, but our students will be selected with the employer partnership. So basically there will be maybe nursing assistant, medical assistant, transport, or even family of the employees who work there, who lived there for so many years, and they would like to become an RN. And as long as they meet our admission criteria, and then the employer will support them with that, tuition support, and we give them the scholarship, they will be enrolled in the program. Sierra View is about 55 miles away from Bakersfield campus, and Coahuila Delta is about 80 miles away from Bakersfield campus. So that's why, Tulare County is ranked as, out of 58 counties, the lowest socioeconomical status. So what we are doing, we're bringing a bachelor degree program in nursing to a community that's gonna elevate even the quality of life and the social and the economical status of this community, because they will be more nurses with a bachelor degree who will be, having a good earning and will support the community. And we also have with us today on standby the Chief Nursing Officer for Sierra View, Dr. Jeff Hudson, and we have Diane Cox, who's the Chief Human Resources Officer, that are working with us on identifying how many seats we need. The number of seats we asked for was very specific based on their math on how many openings they have and they forecast. Therefore, Sierra View asking for 15 seats twice a year, and Coahuila Delta, it's a larger hospital, they ask for 25 twice a year.
Thank you. That's wonderful information. I want to add a couple things that he brought up and kind of expand on for our committee members to kind of keep in the back of their minds as they kind of consider these processes going forward. I don't know that it affects this particular decision right now, but I want to make sure that this is something that's brought up. On the report that UCSF put out that we shared and talked about at the beginning of this discussion, they do account for nurses migrating in and migrating out. You'll see that in the final part of that report. But that is, to Yosef's mention, it's in-state and out-of-state, not from region to region. And he is accurate in talking about some people will go to larger areas and choose to leave Visalia or choose to leave Tulare and such. And we have community college there in Lemoore as well, in that same area. West Hills College, Lemoore is in there. And that is of consideration when you look at people moving in and out of areas. However, even with that information, Joanne Spetz's report with UCSF does say that we should be equal at 2029. And that was throughout California, not regionally specific on their evaluation. So great information, and thank you for partnering and taking those numbers into consideration. One of the things that we do see happening is a lot of our hospital partners are looking at hiring ADN degrees students because they are a more diverse population, and they're working at incorporating the ADNs into their hiring plan, but also ensuring that they advance their degree and going in towards getting a BSN or higher because of the requirements with magnet status and other accreditors that the hospitals and the other healthcare facilities are working with. And so then they partner a lot of times with schools. One thing to really take into consideration when you're looking at these partnerships with schools is it can artificially inflate the numbers. They have a steady enrollment stream coming in through that partnership with a healthcare organization, and their placement numbers are steady at graduation because they're hired at those healthcare organizations. And when you're looking at Title IV funding and you're looking at the various creditors, both nationally or state, they look at those placement numbers as outcomes, very similar to what we do in the nursing programs with NCLEX numbers. And so if you have a steady stream of people coming into your program that you don't really have to advertise and do the work to have them come to you because you're contracted with that employer or have a MOU or an agreement of some sort, then you also have to consider that their graduation numbers, their placement numbers after graduation, can be artificially inflated because they already have secured locations within that. It's not that those numbers of graduates went out and sought new employment based on that academic preparation. So just some considerations. The other thing that has been brought up to us in communications with the COADN, which is the California Organization of Associate Degree Nursing Programs, which are, again, just for all transparency, primarily public universities, public colleges, and is that they cannot offer enrollment tuition decreases and partnerships like this with healthcare organizations in their area, that they don't have the ability to do that. So these partnerships do come primarily through private colleges and universities, and we're very grateful that you guys are doing tuition decreases and taking that stuff into consideration. I know that a previous public member mentioned that students chose that for-profit or not-for-profit private institution on their own. And that is clear, they do. But we also need to take a look from a board perspective that if we're only growing, and our numbers kind of showed that, 1,401 going to private universities and colleges and only 56 going to community colleges. If the growth is only happening in private colleges, then the students are kind of forced to go into those locations because the public universities and colleges are not being grown. And that is not board specific to deal with, because if there's no resources, including faculty and clinical sites that our community colleges and our public institutions are unable to find or support, that's a greater problem that needs to be discussed at a state level versus just within our board. So a lot of things that you brought up, thank you for that. And board members, please just keep that in the back of your head as you kind of make these decisions. But I don't think that it directly impacts this decision right now, because this area is in great need of nursing help, and nursing students will surely address that.
Thank you, Ms. Malby. If I add one comment about placement, our current placement number before the partnership, we're at 92.4% at Unitec College. So, and our career service department is a large department that helps students place. Of course, with this partnership, they will be higher because these employers are ready to hire them. They're going to sponsor them and pay for their education. So thank you. And we support all efforts to improve the number of nurses. And we see the community colleges on this agenda item, there are other community colleges in the same region that are asking for an increased enrollment, which is a great thing. And we fully support them because we need as many nurses as we can. When you look at the last data that came out, which says that nurses between the age of 55 to 64, 22.5% of them will be retiring within the next 2 years. That's huge, from 11% to 22%. So we will be losing a lot of nurses over the next few years, and we're going to need to prepare as many nurses as we can. Thank you.
Thank you so much, Dr. Yosef.
Absolutely.
Jovita?
Thank you. So I believe we need to make a motion to recommend acceptance of substantive change to an approved program enrollment increase for Unitec College Baccalaureate Degree in Nursing Program. Do I have a second?
And if it's okay with you, Jovita, as we did with the last one, I'm going to add in 50 students twice a year, which means 15 students twice a year at the Sierra location and 25 students twice a year at the Kauai location.
Thank you.
So it's very clear.
I appreciate that. Would any committee members second the motion?
Tricia Wen seconds.
Thank you, Tricia. May we take it to public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated.
Oh, sorry, go ahead, sorry.
I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Dr. Jeff Hudson would like to make a comment. 1 second, please. Go ahead, Dr. Hudson.
Can you hear me okay?
Yes, sir. Thank you.
All right. Good afternoon to the board, and thank you so much for this recommendation. It means a tremendous amount to our area that at many times is an RN desert. Many times in my experience here at the hospital, I've been here for 9 years now, we are training nurses from the north and south, often who get into our associate degree programs, which are state-sponsored around us, and often leave at the end of their year. So it just adds to the problem. I know that you have data in front of you that was submitted to the board. I want to update that data a bit because at one time when you were given the data, it was 21.6 turnover rate. We are now at 30%. California Hospital Association is also seen across the state registered nurse turnover now at a historic level of 30%. This is unsustainable, as Dr. Youssef just alluded to briefly. 15 students twice a year will allow us to help meet the need. As of today, I have 79 openings for RNs and another 40 to 50 who are out on any given time with FMLA and IFMLA. So this creates a tremendous challenge over the near future and the future of our organization to be able to stay relevant. We have spent over $9 million in the last 6 months for travel nurses. This is unsustainable for our health system and our community. This will give an opportunity for local students as well as employees of the hospital an option to pursue nursing that they may normally not have in a state-supported system that often they are not able to get into due to outside applicants. We believe this is a solution for some of that. Also, being able to develop this partnership in our region raises the threshold of having bachelor's prepared nurses in addition to the associate degree nurses that we have both graduating from Porterville Community College and College of the Sequoias. So I'm very appreciative for the board's actions, and I look forward to our partnership with Unitech. Thank you very much.
Thank you for your comment. Jay Tomaso would like to make a comment. 1 second, please. Jay Tomaso. Go ahead.
Hi, good afternoon. Actually, this is Diane Cox. I'm on Jamie's system right now, so I apologize for that switch up. I'm the Chief Human Resources Officer for Cahuilla Health, and I just want to thank you for the time of the committee and for your consideration and approval of this. This may be the single most important conversation that I have in my career with you all today. Visalia is located in Tulare County, and Cahuilla Health serves Tulare and Kings County. It's about a population of 600,000 individuals, very socially economically challenged, as Dr. Youssef described. We have 2 nursing schools in our area, College of Sequoias, well, 3, West Hills as well, sorry, and then a private university, San Joaquin Valley College, of which you're familiar, I'm sure. The numbers of students that they are able to graduate don't sufficiently fill our turnover rates. And many of their students that they come in from out of the area and they don't even stay in the Visalia area. So we were underserved prior to COVID. The COVID pandemic has been a setback for us as well as everyone. To give you some updated numbers, when we started this discussion of partnership with Unitech, we had 160 RN openings. Today we have 260. We have a greater than 25% vacancy rate, and our turnover continues to be about 180 to 200 nurses a year. That's not for lack of efforts on retention. We do many things to attempt to retain our nurses, but unfortunately our geography is sufficient to where people come into school and leave or move for higher wages in other areas of the state, or most recently in the last 2 years, leave to be travelers. So we appreciate your consideration. We appreciate your approval very much. The additional seats in our area will literally cause our hospital over the next few years to survive, because we not only need bachelor degrees nurses, we need ADNs. And we appreciate any consideration for adding seats to help us fill the 260 vacancies, but also the additional 180 to 200 that we'll see leave us in any given year because of the shortages, severe shortages in our areas and statewide and nationally. So I appreciate your time. Thank you so much for allowing me to speak.
Diane, I just wanted to let you know, I'm sure you may understand this, but I just want to clarify that this is the committee meeting. So the committee is looking to make a recommendation to the board, but this will become decided on either way at the board meeting in November.
Okay,
thanks.
Great. I appreciate that. Thank
I just
you.
wanted to make sure you knew that this wasn't the final.
I wish it was.
I know, I know, but we're recommending to the board, and the board meeting will be the 14th and 15th of November.
Thank you. I appreciate that.
Sure, no problem.
Thank you for your comment. Committee Chair Dominguez, there are no other public requests for comment. Would you like me to close this window?
Yes, please. I'd like to take it to a vote. I, Jovita Dominguez, votes yes. Committee members, Dr. Mary Fagan,
Mary Fagan, yes.
Tricia Nguyen,
Tricia Nguyen, yes.
and Susan Naranjo.
Susan Naranjo, yes.
Thank you. Motion carries.
Thank you so much. Moving on
Jovita, could we take maybe a 5-minute break?
I see why not.
How about 10 in case we have to walk a little ways to get there?
Actually, yes.
Dolores, why don't we
it's
just
good,
break until 3 p.m.
Exactly.
A solid number to come back.
Yeah.
Thank you.
So we'll see everybody back at
Thank
3.
you.
Okay, do you want to get roll call to establish a quorum, and we can go on to 8.8.4?
This meeting is being recorded.
This is Jovita Dominguez, and I would like to establish quorum for the the education and licensing. I'm present. Is Dr. Mary Fagan present?
I'm here.
And Susan Naranjo?
Yes, I'm here.
And Tricia?
Yes, I'm here.
Thank you.
Okay, let's move on to agenda item 8.8.4. Discussion and possible action regarding acceptance of a substantive change to an approved nursing program. This is for Allen Hancock College Associate Degree Nursing Program. The information on this program starts on page 93 of your packet. And board moderator, if you could please elevate the presenters on the list for Allen Hancock. Allen Hancock College is located in the Central Coast. They have a 2-semester LVN to RN program, and they are requesting an increase of their annual enrollment from 35 students annually to 50 students annually. They would like to begin this in the spring of 23, and thereafter the enrollment will be 50 new students each spring moving forward. Allen Hancock cohorts are admitted each spring and graduated each year in November. Their NEC is on a continuing approval visit today, so I will be presenting with them, and their representatives are here should you have any questions. Thank you.
Do any of the committee members have any questions?
No.
Okay, then I motion to recommend the acceptance of a substantive change to an approved program enrollment increase for Allen Hancock College Associate Degree in Nursing Program. Do I have a second?
Again, I'm sorry, Jovita, just really quickly, I'm also going to add to the motion the enrollment increase of 50 students annually, starting in spring of 23.
Thank you.
You're welcome.
Do I have a second?
This is Mary. I'll second that motion.
Thank you. May we take it to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please, and I will take it to a vote. I hope Jovita Dominguez votes yes. Committee members, Dr. Mary Fagan,
Mary Fagan, yes.
Trisha Nguyen,
Yes.
Susan Aranco.
Yes.
Motion carries. Thank you.
Thank you all very much. Moving on to agenda item 8.8.5, discussion and possible action regarding acceptance of substantive changes to an approved program. This is the College of Sequoia's Associate Degree Nursing Program, and they are asking for an enrollment increase. Information on this program can be found on page 100 of your packet. Board moderator, will you please elevate the College of Sequoia representatives? So the College of Sequoias in the Central Valley is requesting to continue a one-time approved program track where students take one course at a time over year-round in their schedule to complete the program. They requested this particular track back in November of 21, and they requested it and were approved for 1 year. They would like to continue this, and the enrollment pattern that they would be continuing is 20 students annually, starting in March of 23. The NEC and the program representatives are available for questions. Thank you.
Do any committee members have any questions?
No.
Okay. Then I motion to recommend acceptance of substantial changes to an approved program enrollment increase for College of the Sequoias Associate Degree in Nursing Program. Marianne, did you want to add the numbers?
Yes, I will. I will add the numbers of continuing with 20 students annually.
Thank you. Do I have a second?
Trisha Nguyen seconds.
May we take it to public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. And I'd like to take it to a vote. I hope Jovita Dominguez votes yes. Committee members, Dr. Fagan,
Mayor Fagan, yes.
Trisha Nguyen,
Tricia Nguyen, yes.
Susan Arango.
Susan Aranjo, yes.
Thank you. Motion carries.
Thank you so much. Agenda item 8.8.6, discussion and possible action regarding acceptance of a substantive change to an approved program, Porterville College Associate Degree Nursing Program enrollment increase. Information on this program can be found starting on page 105 in your packet. And board moderator, if you could please elevate the presenters on the list for Porterville. Porterville College, again in that Central Valley area, is requesting an enrollment increase from 20 students once a year to 20 students twice a year. So their enrollment will double yearly from 20 to 40. The purpose of the proposed increase would start in January for their spring cohort. So they're going to go twice a year. So they have a spring cohort of 20 and a fall cohort of 20. The NEC and the program representatives are available for questions. Thank you.
This is Jovita. I do have a question. I was noticing the drop in the NCLEX pass rates from 94.44% in 2021 to 2021 to 2022 to 76.67. I know that you're still at the pass rate of greater than 75, but that sort of caught my eye. Is there an insight why the big drop?
Kim, did you want to speak to that? Kim is the program director for Porterville College.
Hi, this is Kim Behrens. Yeah, the decrease, we've been exploring the why. It was a struggle with COVID, with a lot of online teaching. And our students here are very underserved. Resources, laptops, getting, this was the cohort right in the middle of the heart of COVID. When it first hit, and getting them the resources they needed, getting laptops out to them, Wi-Fi access. And that first semester, we did get them all back on campus, face to face. And it was a struggle. We saw the clinicals at that year one, getting them the clinical experience that traditionally we had offered. We were, thinking outside the box, and it just wasn't as effective. And we're back to where we were. The recent cohort, the cohort itself is at 84%, the one that just graduated in May. I believe our first quarter pass rates, I should have printed that, it's 87%. So we're popping right back up. We have no concerns that we will be back to our 94 percentile where we were for 94, 95 for several years in a row.
Jovita, this is Lori, and just to further expand on that, the intention is to provide a breakdown of the NCLEX pass rates for all of the nursing programs at the November board meeting. It was definitely palpable in California and across the nation that the provisions that were put in place to manage through the COVID pandemic, with the decrease in direct patient care clinical requirements, going to online, doing computer-based simulations, et cetera, had an impact. And across the board, the California NCLEX pass rates, as well as the nation, dipped. We dropped pretty much across the board. There were some schools that stayed steady, and of course ELAC, who increased theirs, but that was through a lot of work. And so with that, it is important for our board to take into consideration of the impact on the COVID provisions, the decrease in direct patient care, the increase in simulation, including computer-based simulation, not in-person simulation, as things that will affect this pass rate and pass rates going forward. Understand that those initial provisions were put into place in April of 2020 through the DCA waiver, and that decreased everything down to 50%. And then with the passing of AB 2288, it kept med-surg and geri at 50%, dropped OB, ped, psych, mental health down to 25%, and then allowed for psych and pediatrics and OB to be done, the direct patient care to be done in telehealth only. We had a lot of schools at that point that did not have an understanding of what telehealth was. And they were really desperate and trying hard to create direct patient care experiences. So they were actually utilizing their faculty as providers and interviewing and providing education and contact to students, family members, et cetera, to do like psych evals, all kinds of stuff through a mock telehealth experience. And so through a lot of re-education on telehealth being a modality only, that the direct patient care is through an established patient, nurse, and provider relationship where there has to be like billing and records and a legit encounter documented and referred out of things identified. That started to change, but it took quite a while to work with the program directors through the NECs to get that information appropriately explained out there and those changes to take place. So we will be seeing the effects of this for a year or so still. I'm confident because a lot of times when the legislative personnel were discussing passing AB 2288, they talked about this being a temporary process and that these provisions were only going to be, during the state of emergency, which everybody at that point in 2020 kind of expected a year, if that. And we are still operating under those same provisions in 2022, and those provisions don't end until the end of the academic year in 2023. So we will have 3 entire years of these decreased provisions, decreased requirements, as provisions for our graduating nursing students. So the good thing is that as this school stated, they're bringing people back on campus, they're returning to clinicals, they're kind of going back to the norm, independent of the provisions that were outlined in 2288, so that they can give their students the educational preparation that has been proven over years and years of successful student outcomes and really great NCLEX pass rates. So that is something to absolutely take into consideration when we look at the NCLEX pass rates over the next couple of years, is they will have been affected by those COVID provisions. And grateful that those are coming to an end. Grateful that the concurrency requirement is the one that has been carried over. But this was also outlined in a study from NCSBN when they talked about 50% simulation to clinical direct patient care. And it did show that the minority and underserved did not fare as well with an increased simulation than they do within direct patient care and hands-on experience. And this is what's being shown right here is she just stated that they have an underserved population, and that population does not do well repeatedly in these simulated environments. So thank you for being aware of that and working towards getting that addressed and fixed, and happy to hear that your NCLEX rates are going back up.
Thank you very much. I'd like to take the motion to accept the substantive changes of an approved program enrollment increase for Porterville College Associate Degree in Nursing Program. Do I have a second?
Sorry to interrupt again. I'm going to add the 40 increase to enrollment of 40 students twice a year.
Thank you.
Trisha Wynn seconds.
Thank you, Trisha. May we take it to public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Dr. Jeff
Okay.
Hudson would like to make a comment. 1 second, please.
Good afternoon again. As I come back to my colleague, the Dean of Porterville Community College, I want to speak highly of our relationship and partnership with our local community college in our community. They are the sole source of many of the nurses who come on staff at the health district, and we are grateful for that. We actually work in partnership, having a student to transition to practice formal program accredited through AACN and Vizient. And Dean Behrens is part of that advisory group so that we have connectivity on our students graduating and coming into practice for their first full year of transition to providing care in the hospital. We also work collaboratively around decision-making and support of and other resources that are needed to make sure that our underserved area has the amount of nurses coming out of college that we can appropriately put into our organizations. As you heard earlier from me, that is still not at par where we need to have enough nurses, but I wholeheartedly agree with Dean Behrens that we need to increase the amount of students at the community college level. So that would give us some more opportunity for AD graduates to be in the program and in the local area and support our hospital, which is standalone and serves a population of 110,000 souls. So I thank you for my comments.
Thank you for your comment. Committee Chair Dominguez, there are no other public requests for comment. Would you like me to close this window?
Yes, please, and I'd like to take it.
Jovita?
Yes.
I'm sorry to interrupt. I think I misspoke, and I want to make sure that it's clear. The recommendation is to accept the substantive change for an approved program with an enrollment increase for Porterville College. And the enrollment increase is 20 students twice a year, which is 40 students annually.
Yes.
Thank you.
With that, Tricia, are you still okay with the changes?
Yes.
Thank you. Then I'll take it to a vote. Jovita Dominguez votes yes. Committee members, Dr. Mary Fagan.
Mary Fagan, yes.
Tricia Nguyen.
Tricia Nguyen, yes.
And Susan Naranjo.
Susan Naranjo, yes.
Thank you. Motion carries.
Thank you so much. Agenda item 8.9, discussion and possible action regarding the initial self-study for a new pre-licensure program, Palo Verde College Associate Degree Nursing Program. The information on this program can be found starting on page 109 in your packet. And board moderator, if you could please elevate the presenters on the list for Palo Verde. This program had a feasibility study that was approved by the board in February of 2021. They have now completed their initial self-study and they're ready to start enrollment in the spring of 23. The enrollment pattern request is 20 students annually. I did complete a virtual visit in July of 22, finding adequate resources available and planned to support this new program. The program was found to be in compliance with all board rules and regulations. I'm their NEC and representatives are here to answer any of your questions. Thank you.
And I'll give new board members some background on what this is. So we have a process that we use for institutions seeking new approval. It is outlined in our California Code of Regulations 1421. And amongst that, they are to utilize a form that's called the EDP IO1, and it gives a step-by-step process starting with the letter of intent and moving them all the way through to acceptance of the self-study, which is the phase that we're at right now with this school, where they can, as soon as you accept it, they can enroll students in and start their process. The first part with the letter of intent tells us that they are planning to do a school, offer a nursing program, what degree they're planning to confer at the end of that program, and what institution is backing them up. Then you go into the feasibility where they prove that there is a need in that area and that they have the ability to support that. So when the board accepts a feasibility study, the board is saying, yep, we understand that this is needed, we agree, and move forward. And that allows the program to then start hiring a nursing program director, obtaining a location, investing money, hiring on faculty and staff, developing curriculum, obtaining a sim lab or a skills lab, and really going forth, getting ready to enroll students. So the last step of that is to do a self-study, which is where this one's at. And this self-study takes a look at all of our board's rules and regulations around pre-licensure nursing programs, and the NEC assigned to them go and make sure that they're in compliance with everything. Once they're in compliance with all of them, the NEC brings it to the ELC and then on to board for approval. And so with the acceptance of this self-study, we will have a brand new nursing program in California that will be serving that area that has already been deemed a need and the ability to support through the feasibility process that's already been completed on this one. And if the board did decide to defer action by not doing anything because they need further information, that's always a possibility. Or they can not recommend. And if you're going to look at a not recommend, I really ask you guys to go back and look at what happened in feasibility, because that feasibility study, when the board accepted it, pretty much gave the academic institution the thumbs up. So they started to actually not just dream about a school and lay out a plan for a school, but started investing the money. So buying the locations, renting the locations, hiring faculty, getting curriculum developed, starting an outreach, because now they have a good understanding that they'll be able to meet all rules and regulations. The boards will accept it. So this is where we're at with this one. If you have any questions, I'd love to be here and answer any questions for you. And so this is an acceptance of a self-study, but what that means in layman terms is if you guys accept it or recommend accepting to the board, when the board accepts this, we have a brand new school, and this school will now start enrolling nursing students into that newly developed nursing program.
Thank you for the explanation, Lori. Do any committee members have any questions?
No.
Okay, then I take a motion to recommend acceptance of the initial self-study for new pre-licensure programs, Palo Verde College Associate Degree Nursing Program. Do I have a second?
20 students annually.
20 students annually. Thank you.
Tricia Wynn seconds.
Thank you, Tricia. May we take it to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give reminders as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. And I'd like to take it to a vote. I, Jovita Dominguez, votes yes. Committee members, Dr. Mary Fagan,
Mary Fagan, yes.
Tricia Wynn,
Tricia Wynn, yes.
Susan Naranjo?
Susan, yes.
Thank you. Motion carries. And that brings us to 8.10, to adjournment. Thank you, everyone.